administration is pushing for national health care. It says that the national health care will help stop the rampant increases in health care costs. What are your thoughts on the government control of our health care system?
Well, first, we don't need government controlling anything other than our borders. And at this point, what we need to look at, again, is the waste and the fraud that's associated with Medicare and Medicaid. Those are the two government health care programs we have now. They're so poorly run that how can Obama or anyone sell the American people a new program when the programs we have are failing us? But they're failing because of graft, fraud, misuse of funds, waste. And so we take a look at the Medicare and Medicaid, we go in, we clean them up, and we lop off the top end, which is all of the administrative costs. We have no business talking about nationalizing anything. We have no business talking about nationalizing anything, especially health care, when the government can't manage its own government health care system now. Let's take a look at cleaning it up and reducing the waste and the fraud.
So what approach would you offer in terms of helping the American people get health care coverage in the private sector?
Well, again, I think the premise is false. Everyone's running around like the sky's falling, like there's a healthcare crisis. We still lead the world, the free world, in the quality of healthcare and the availability of healthcare. We have a national healthcare system now. No one can be denied healthcare. So when we look at the programs we have, again, we need to clean them up. We need to make sure the programs we have work. And then we allow the states to take care of those who need other health care. Almost every state in the union has its own state health care system. So we have Medicare, we have Medicaid. In Arizona, we have Access. In California, it's Medi-Cal, TennCare in Tennessee. All of them are struggling with the same fraud and waste and misuse of the funds that are supposed to go to the people. So let's take a look at the programs we have first. And if anything else works, it's the American people having a tax credit to put into a savings account that ensures that they can cover the cost of health care. Everyone's talking about the crisis. There is no crisis. And the market is already correcting itself in the cost of health care, which is, we've seen the trend is that it's coming down, that people are spending less on health care, getting better quality health care, and getting more access to health care. So where's the crisis in the first place? We have programs that are in place to help those who are in need of these programs. Let's make sure it's going to the people who actually need it and get the people out of the system who can afford their own health care.
Now, there, of course, the common mantra amongst the Democrats are that there's 40 million people without health insurance. Mm-hmm. We know that how many of those people are illegal immigrants?
Well, that certainly would be another savings, especially California obviously is feeling that now, and we've been addressing that in Arizona. So again, I want to follow the model that our Arizona State Legislature has done. Let's take a look at Access. Let's clean up the fraud, the waste, and the abuse. The savings go into ensuring that system can help those indigent or the children or the people who actually need it. So it's there to support those who are in need. Well, are the Democrats, when they talk about the uninsured, are they including illegal aliens in our country? Because the numbers now look to be between 15 to 20 million people are in this country unauthorized, taking advantage of our social services that we pay for. So let's eliminate those 15 to 20 million that are here, and then we may only have 10 to 15 million actual U.S. citizens who would need to buy into a program or who would need extra assistance. And certainly as a charitable nation, we've always been there to help our fellow Americans, and we do need some sort of safety net for many of them. But again, we have that already. There's Medicare, there's Medicaid, and there's state health care services that are provided. There should be no one that's being denied any health care, and certainly we're all getting the best health care that mankind's ever known. The 15 to 20 million illegal aliens in this country certainly cost the taxpayers billions of dollars that could be turned back into providing for the needy here. The same is true with our education system. The same is true with our incarceration system and our court systems. Deporting 15 to 20 million illegal aliens would save the American taxpayers trillions of dollars across all kinds of programs and benefits that they're receiving that should be going only to U.S. citizens.